Good day, everyone. My name is Dr. Bobola Agbonle. I'm the Director, University Health Services, Delta State University. And we're bringing to you information about cervical cancer, things that can help you. What really is cervical cancer? Where is the cervix? The cervix is the neck of the womb. It's that place where you see the baby's head coming out from when the woman has a normal delivery. And that place has special cells. Now, when cells begin to multiply abnormally or overgrow, that's when we begin to have cancer. And it doesn't just stay maybe in that area, it may spread to other areas of the body. And that's, where we have problems. Now, the primary cause of cervical cancer is a virus called the Human Papillomavirus. And the virus has many strains, many types. So it's not all types, but a few of them that cause the cervical cancer. And it's spread primarily through sex. So one of the areas where we look at to control, we ask, women, we ask youths, we ask girls, don't have sex too early. Don't expose yourself to early sex. That's maybe at a young age you're already exposed. Those are the things we don't want them to do. And then not to have multiple partners. The other things that can also, risks that can also increase the exposure to the human papillomavirus is when there are other infections, like you have HIV, other sexually transmitted infections going on at the same time. They also help in the spread of human papilloma virus. Another problem is when immunity is low. So we are always encouraged to eat well. Eat well and also do exercise. When you eat well and do exercise, they improve your immunity. Other things that can also bring about cervical cancer is drugs. There are certain drugs that were taken in the 1950s that that people realize that the daughters of such women that use such drugs, some of them had cervical cancer. Another problem is smoking. Smoking also encourages the growth of the cancers. We need to also know the warning signs and symptoms. Signs are what the doctor picks, and then symptoms are what the patients tell us. So some of the symptoms that women may have is some of them may not have any symptoms at all, no pain, nothing abnormal going on, but the cancer is growing. Other symptoms that may be seen are low back pain, waist pain, heaviness in the waist region, leg swelling, offensive vaginal discharge, then bleeding. This is not the normal period. This one may come up in between the normal periods, or a woman that has already achieved menopause, after menopause, or in a woman that maybe after sex you now notice that there's bleeding, which is called postcoital bleeding. That's another type of bleeding that when you see it, you get wary of what you have seen. And then prolonged and heavy bleeding. Now, if you present to us in the hospital, a doctor or a nurse, healthcare provider may, maybe as you talk, they may ask you some questions, and maybe you present and you tell them, oh, I've had a persistent lower back pain, or we do a vaginal test for you, examination for you, and there's bleeding after the test. We will, wary of what we are also seeing. And then we're also careful about those in the older age group. Talking about screening, how often should a woman be screened? Now, screening is a preventive way of protecting women from developing or having an aggressive form of the cervical cancer. And the screening that is done, there are different types. You have the visual inspections with acetic acid and with Lugol's iodine, which we've used here in the university during our last screening. And we also have the pap smear. Pap smear is a higher form of screening. It would, the pathologist will be able to look at the cells and determine, is this cell normal, is it abnormal? You'll be able to tell, from the pap smear. But the visual inspection gives us a kind of broad overview. You'll be able to see the cervix. Is it normal? Is it tending to abnormal? And then from that visual inspection, you can sieve out those that are highly suspected. We now send them to go and do a pap smear. Now, it's normally done for women that are sexually active, and then from the ages between 20 to 65 years. And we normally tell women you should do it every 3 years. So if you've done this year, you wait until another 3 years before you do it again. But then again, if there's a family history of cervical cancer, such a woman is encouraged to do it maybe once every year, or as your doctor prescribes for you to do. Because sometimes you come to us, we see certain signs. Even if you have done it before, we'll say, oh, please, I need you to run this test again. And like I tell women, when we ask you to do visual inspection or a pap smear, it's almost like this is like my immunization. This is the easiest way, quickest way to see something. And then if it is caught, we send you over to the gynecologist. The gynecologist will follow up, and then depending on what needs to be done, they do what should be done for that woman. Now, there are also vaccines available now. Human Papillomavirus vaccine, and it's given to young girls between the age of 9 to 14 years because these ones are unlikely to have been sexually exposed. If a woman is sexually exposed, we do not advocate that you need the vaccine. But if, the woman has already been exposed, there's no need for the vaccine. What we now say is do the pap smear or do the visual inspection. And the vaccine is also given to boys in some countries, so it's not only for girls. And I want to also chip in that we planned in the health center here in DELSU to continue to do the visual inspection on Tuesdays starting February. That's next week. Tuesday we'll be doing the visual inspection to also help women get the necessary health care that they can get from us. So as from February on Tuesdays, they can come to the health center and see us here, and we'll do the visual inspection. So after doing the visual inspection, if we feel you need further care, we refer you to go and do a pap smear. Thank you.
Okay, thank you very much. Is there any fear when you come for, because you were saying that girls between the ages of 9 to 14 that are not sexually active will go for the vaccine.
Yes.
I think one of the vaccines. So now, with the generation that we have today, children will not come tell their parents that they are sexually active. So what do you stay in a good position, not to harm the person in question who is shy to say she's into a sexually or a sexual relationship?
Okay.
So how do you detect that before the vaccine?
Okay, so the vaccinators are trained in such things, and they will ask questions. They wouldn't just assume and give. They are trained to ask. So I believe as they get there, because last 2 years or so, last year the vaccine was now added to the vaccines that are given in Nigeria to girls. So they started giving it. I think you can walk into any primary healthcare center and get the vaccine.
Okay. So women that are coming for the visual inspection, like you said, what and what should they be expecting?
Okay, so any woman coming for the visual inspection should not be on her menstrual period. She should not have had sex for 48 hours. They shouldn't put anything also into the vagina, previous 48 hours. Do you understand? Because some women, they douche, they put things to, I want to clean up, so we don't want you to put anything, so that what we see is a normal cervix, not tampered with. So no sex, no insertion of drugs or things, or you can just clean up normal water and soap cleaning up.
Now, a lot of women, some women complain that after the vaccine or screening, they developed the cancer. How true is that?
I don't think that would be true. After the screening,
is there a possibility that it may come up if a person have it in them?
Yes, it's possible.
Okay.
It is possible, and that's why it's not advocated to give to. That the vaccine is not meant for women that are already sexually active, because if you're sexually active, you can't blame the vaccine. Yeah, it may have been there before the vaccine was given. And the vaccine comes in either, it depends on the product, is either a single dose or 2 doses.
How do you think a woman can protect her vaginal health in terms of cleanliness and all that? Because we have a lot of products and we have a lot of people say every little changes in the vagina, they tell you is vaginal infection and all that. So how do you think a woman can protect herself from cervical cancer?
First of all, I always advocate that every woman should know her normal period, know your body. No matter the age you are, once you should know how your period is. Is it 28 days? Is it 21 days? Is it 30? Whatever your period is, you should know. And then you should also know the secretions that come out of your body in under normal circumstances now. So it's good that young girls know this is the normal secretion I see. So when the abnormal comes, they're also able to detect. Yes, they should be able to tell this is normal and this is not normal. The reason why I'm saying a woman should know her normal period is because you may have 28 days, your friend may have 30 days, 29 days. What your friend has is not you. You should know yours, and then you should be able to tell this is the normal secretion I'm having, the pap type, the egg white type. This is what's happening at this point in time, the one that happened during ovulation and all that. You should know your body, so that when it becomes abnormal, you are able to detect, not because somebody said. So you know when there's itching, you know when it's normal. You should be able to tell. It goes a long way.
We truly appreciate you for the time.
You're welcome.